Thank you everybody. Thanks for coming to our TED Talk. My name's Brianna. Today we're going to be talking about systemic racism in healthcare, and these are my cohorts.
I'm Ariana.
I'm Sarah.
I'm Asma.
All right, we're going to get started. The first thing that we're going to talk about today is going to just be this, racial and economic discrimination is all together. It's all one piece, but it is so many things intertwined. Poor health outcomes are cyclical in minority communities, especially in Black patients. There are consistently higher incidences of negative experiences in medical settings for these patients. There is an exposure to racism in healthcare from a young age, and this fuels mistrust in the system. And this perpetuates a cycle of poor health outcomes due to the underutilization or delayed utilization of healthcare services. This systemic issue is particularly concerning with healthcare, considering the supposed commitment to health, wellness, and doing no harm. Racism is obviously a problem in more areas than just healthcare. This issue is pervasive and influences all areas of life for minorities. Racism has even been declared a public health emergency of global concern, not only in the unequal healthcare delivery for minority groups in the United States, but also in the disproportionate amount of violence against minorities. And now we're going to look at specifically the pervasive racist stereotypes in medicine. So this is just a little bit of background because the roots of this mistrust are, they run deep for good reason. In the 1820s, Dr. Thomas Hamilton performed experiments on people that he had enslaved to prove that Black skin was thicker than white skin, and therefore Black people felt less pain. Slave owners and doctors who wanted to experiment on their enslaved people really ate this up, even though it was an unfounded scientific revelation. And this was an excuse to continue experimenting on enslaved Black people without anesthesia. And this persists. A 2016 poll of 222 white medical students showed that half of them endorsed at least one myth about the proposed physiological differences between Black and white people, especially regarding pain tolerance. 1/3 of these students believe that Black skin is thicker than white skin, and others believe that Black people have less sensitive nerve endings. In the 1850s, Samuel Cartwright claimed that people of color have a lower lung capacity, and then even took it a step further to propose that forced labor was good for them because it would enhance their lung function. In medicine today, the year 2022, it has not been scientifically proven that this has any validity, but despite this, spirometry lung function tests are still calculated with a correction for race, with the goals for Black people being about 13% lower than whites. The implication for this correction, if this medical myth holds no water, could be deadly. This means that lung disease causing decreased spirometer results would still show normal numbers in a Black person, even if it would be decreased in a white person. And lung disease will go unnoticed for longer and have, more substantial results. There are so many incidents of abuse for Black people in the United States that it could be its own hours-long presentation. But suffice it to say that from the gruesome experiments on enslaved people, the forced sterilizations of Black women, the Tuskegee syphilis study, and many more, generational mistrust in healthcare in a system comprised of many white men is more than understandable.
It's May 2020, in the midst of the COVID-19 pandemic, and George Floyd was murdered over 7 minutes and 46 seconds. His pleas were left unheard by the many cops there without any intervention to save his life. His public execution led to a resurgence of the Black Lives Matter protests, where thousands gathered demanding for justice for George Floyd and all Black Americans. Black Americans have been killed at more than twice the rate of white Americans at a steady rate since 2015. Premature death at the hands of police is just one of the challenges faced by Black Americans in 2020, along with an increased incidence of chronic health conditions, substandard housing, and barriers to health insurance. These challenges contributed to the racial imbalance of COVID-19 infection and complication rates, with estimates that Black Americans have a 15% higher chance of dying from COVID-19 than white Americans. Triggered by the COVID-19 pandemic and the public death of George Floyd, the nation became aware of the societal implications of racism in all facets of the community and decided that change was necessary. Maternal mortality disparities are shown here. So from the CDC in 2021, Black women are 3 times more likely to die from a pregnancy-related cause of death. Even disparities in dentistry. In patients with similar symptoms, Black patients were more frequently offered tooth extraction rather than restorative root canals. When resident cardiologists were presented with standard hypothetical situations, they were less likely to refer minority patients for a cardiac catheterization. Because of the medical myths mentioned earlier, Black patients' pain is frequently underestimated and undertreated.
Okay, so now we're going to talk about the beginning of a paradigm shift and why it's important. So some parts of the social determinants of health, which include safe housing, education, and access to healthcare, makes a big difference here. It has a significant impact on the quality of life as a society, which includes the minority population. In a world where racial and ethnic stereotyping kind of holds us hostages to our own biases, in inequality, especially in healthcare, it makes a difference between life and death for a lot of minority populations. It is the biases that holds healthcare providers back from providing the care that they would standardly provide all their patients. And therefore, a lot of the minority patients, when they have their concerns, which became really evident in COVID-19, all of their concerns are dismissed. A lot of times when we saw patients complaining of being short of breath or pain or anything like that, as Ari and Bree previously spoke about as well, they were dismissed, and it was just, they made it seem like it was rooted in not enough evidence. This is all due to the lack of having a standardized treatment and having their concerns dismissed. The discrepancy has created mistrust of healthcare provider within the vulnerable population. Patients are often at their most vulnerable when they show up to the hospitals and to the care clinics. And having healthcare teams that are not very culturally trained, that are not very well versed with different ethnic groups, it kind of further widens that gap for them and makes it difficult for these populations to trust the healthcare providers that they're coming to see, which is why you'll see a lot of African Americans, they trust more of African American physicians or Black physicians because they feel more cared for, more appropriately cared for, they can trust them more. Even in the studies there's been multiple studies that were reviewed which showed that Black patients that saw Black physicians had more appropriate care and actually had more frequent annuals and kept up with their health care as compared to when they were seen by a white physician or anyone that they didn't feel like was very well versed with their culture. The Black Lives Movement brings the disparities to the forefront. Implicit biases and structural racism have been brought to the forefront. With this awareness of privilege and equity, we can start moving forward to seek equality for all cultures and all ethnicity.
Now I'm going to speak on how we can make a societal change. Many solutions have been proposed to correct racism in the healthcare system, but to be effective, these solutions must include all areas of inequity. Social determinants of health cannot improve unless the systemic causes of health inequality are resolved. This can be challenged from the standpoint of the social ecological model, which with actions taken at every level from interpersonal to societal. Individual level interventions can include self-reflection tools to reveal implicit and unconscious bias, to make individuals aware of stereotypes about different racial groups. Interpersonal interventions should be focused on providing meaningful interactions between providers and patients to address racial health disparities and mitigate harmful practices. Community-level interventions allow for meaningful relationships to develop between healthcare organizations and the populations or geographic communities that they serve. Organizational level interventions focus on processes or structures within an organization to allow for a more diversified perspective, such as creating a consultation group, human resource policies, or hosting conferences and workshops to affect organizational change. Interventions at the policy level are focused on the frameworks, guidelines, and recommendations for regulations and processes at a system level. This level affects the most change societally, but have proven difficult to achieve, especially in the bipartisan society we find ourselves in today. Society as a whole needs to make conscious, deliberate decisions and efforts that work to dismantle societal racism. The business model of U.S. health insurance providers enable a tiered and racial segregated healthcare delivery, resulting in gaps in access to care between racial and ethnic groups, as seen in maternal mortality rates. To resolve this, we must divest from racial health inequities. A single-payer healthcare system would fill the gaps that our current system creates. The healthcare workforce needs more diversity to promote equity, as a predominantly white healthcare workforce affects the economic mobility and therefore health of minority groups. This can be achieved by creating high school and college tracks for underrepresented minorities to increase entry level into healthcare careers. The workers within must be required to take courses that teach the health effects of structural racism and training to recognize and combat implicit bias. Healthcare systems should be mandated to measure and report equity and outcomes to address structural racism. Healthcare professionals and systems must also play a role in protecting and advocating for each member of their community as potential patients. Victims of police brutality may become patients with injuries or disabilities, and these systems should be in the forefront of advocating for an end to state sanctioned abuse as a cause of preventable death in the U.S. Surprisingly, allowing equitable and accessible health care is a controversial issue. Acknowledging racism and white privilege is also a controversial issue. But if somehow our policymakers allow us to make these changes, healthcare can become equitable for all members of society, providing everyone a fair and just opportunity to be healthy.
In order to have a healthy, ethically inclusive community, we need improved community education regarding healthcare access. Improving community education empowers the community by providing knowledge about access to healthcare and having a say in their treatments. Racial inequality and disparities have always existed, but are often overlooked due to the shift in power between minority and majority populations. They were often underreported and dismissed by using trivial excuses. In recent years, there has been a shift in that perspective, mainly due to social media giving everyone access to document and share discriminatory acts. There has been a movement to raise awareness and move forward to equal treatment for all ethnicities. Despite having evidence of lived experiences, there is still reluctance from the majority population to address racial inequality. The racial power shift also resides inside the doors of care facilities, where the most vulnerable population are frequently taken advantage of or mistreated due to racial profiling and the lack of education. Having more structurally competent interprofessional teams prepares us to tackle our own bias to provide more restorative care. Because society has built up social norms based on racism, integrating cultural awareness into training can help break down those barriers. Cultural awareness and education can also contribute to improved social determinants of health, promoting a healthy community for all, and efforts to close income, housing, and educational gaps. Thanks for coming to our TED Talk.